So this video will review the anemia content. As you can see on the picture on the right, the difference between normal blood and anemic blood. There are far more red blood cells in normal blood, with a lack thereof in anemia. The picture on the left shows the signs and symptoms of anemia, such as pallor, shortness of breath, fatigue. Basically, it's the body not getting the oxygen that it needs because there's not that carrier transport mechanism. There are many different kinds of anemia, one of which that we looked at pretty extensively is sickle cell. We had that homework assignment that described the basic process. This is just once again a review of how sickle cell anemia affects the body and some of the symptoms that you'll have with it. To figure out the type of the anemia the patient has, is one of the things you can do is get an MCV. Normal is 80 to 100. If it's greater than 100, then you're looking at your macrocytic anemias. These are going to be your B12, your folic acid, and you'd get labs to distinguish that. You'd get like a folate and a B12. If it's low, your microcytic, you're looking at your iron deficiencies, and then you'd go ahead and get iron studies. So that's one way to kind of delineate which type of anemia this patient may have. Now that we've looked at low red blood cells, we'll look at low white blood cells. Now, one thing to remember that neutropenia, low white blood cells, as well as leukocytosis, high white blood cells, both can indicate infection if you're looking at this on a panel. The clinical features of low white blood cells are going to be infectious complaints such as oral ulcers, pus, pneumonias, any infectious type symptoms. Next up is thrombocytopenia or low platelets. The picture on the right side of this slide shows some of the clinical manifestations, including purpura, petechiae. The patient can have bruising. They can actually even bleed. On the left side, it shows the different causes of thrombocytopenia and what can happen to eat up those platelets. And in the middle is a list of the signs and symptoms that patient with thrombocytopenia can have. Heparin-induced thrombocytopenia was covered in this unit. And this happens when the body releases PF4 from activated platelets. That's platelet factor 4. Heparin binds to this PF4, which undergoes a conformational change and expresses a new antigen. Individuals with HIT produce IgG antibodies that specifically react with this new complex and form immune complexes. These immune complexes bind to platelet receptors, aggregate, they consume the platelets, causing thrombocytopenia. DIC, or disseminated intravascular coagulation, was also covered in this unit. Now, these people with DIC are very, very sick and typically are being monitored for sepsis or burns. They're often in the ICU, and this is a very devastating development within their disease process. Basically, their coagulation system becomes hyperactivated, which means that they form clots throughout their system and can have ischemia to organs, to limbs, to tissues. They can have strokes. They clot off wherever these blood clots go and embed, preventing blood flow distally. Now, since their coagulation system is hyperactivated, they use up all their factors, platelets, from forming clots everywhere. So after their factors and platelets are used up, they go into a bleeding phase where they now bleed from everywhere. They have prolonged PT, INR, PTT, fibrinogen. And basically at this point, your focus is replenishing blood, plasma, FFP, everything that the patient is low on, you give back. The important thing to remember with DIC is that that the people are very, very sick. There's a period of overactivated clotting, so they can have ischemia. That is followed by consumption of all of their clotting factors and platelets, so then it can later be followed by a bleeding phase. So there is both ischemia and hemorrhaging. This picture shows how the different organs may present in DIC in both the ischemic and hemorrhage portion of this disease process. I wanted to leave you with a list of all the different coagulopathies that there are out there. I thought this pretty much covered almost everything. I don't see a lot of organ failure on here, such as liver disease. Remember that the liver makes all your factors as well as components of blood and protein. So, liver disease can cause coagulopathies as well as the different diseases that are listed here in the diagram.